Good morning, SSG Pips. Welcome back to our Wellness Wednesday webinar. Our topic for today is about COPD emphysema. So, what are the discussion outlines? So, we have the definition, symptoms, causes, diagnosis, treatment, and prevention. So, what is emphysema? Emphysema is a progressive respiratory disease. In this condition, millions of the lungs' tiny air sacs, or the alveoli, stretch out of shape or rupture as this thin, fragile air sac become damaged or destroyed. The lungs lose their natural elasticity. So, what is alveoli? Alveoli are small, thin-walled, very fragile air sacs located in clusters at the end of the bronchial tubes, which is located in our lungs, in which the blood exchange oxygen and carbon dioxide during the process of breathing in and breathing out. So, what are the symptoms of emphysema? So, main symptoms is cough, we have wheezing, shortness of breath, ongoing feeling of not being able to get enough air, long-term cough or smoker's cough, sometimes may phlegm siya, sometimes wala. And then long-term mucus production, so hindi nauubos yung phlegm na nandun sa alveoli. And then you can feel also fatigue. So what are the causes? So the number one cause of having emphysema is cigarette smoking. So 90% of all cases, ganun po yung main cause ng emphysema. And then the next one is secondhand smoke. Yung mga hindi nagsusmoke and then they were exposed to smokers. And then occupational exposures to fumes, dust, and vapors. Air pollution, asthma, and alpha-1 antitrypsin deficiency. So antitrypsin, it is a protein made by the liver that protects the lungs. So kapag meron tayong kulang doon, you are high risk of having emphysema. So what are the diagnoses? So we have the x-rays. So these are the laboratory tests na gagawin ng mga doctors in order for them to rule out if you have emphysema. Pulse oximetry, we have that here. Spirometry and pulmonary function test. So yung hinahawakan on the upper right hand side of the picture, yung hinahawakan ng bata, that's spirometry. So mini-measure yung oxygen ng lungs natin and carbon dioxide kung meron bang maganda ba yung gas exchange sa loob ng lungs natin. And then arterial blood gas. So kukuha ng blood mainly on our brachial artery and ilalagay siya sa isang machine to check if there's enough oxygen na meron tayo sa blood. And then the electrocardiogram to test or to check the function of your heart para check din if nanggagaling ba sa heart yung cause ng shortness of breath. And to add also the spirometry, it also measures if meron blockage sa airway natin kapag poor yung may specific percentage kasi or measurement na kailangan i-meet yung patient. Kapag hindi umabot nun, it means to say there might be something wrong with their lung. So what are the treatments? So number one, of course, quit smoking because that is the main cause. And then the doctor will prescribe bronchodilator medications and then anti-inflammatory medications kasi nga namamagay yung mga alveoli natin due to continuous mucus production. And then antibiotics kasi may times na yung inflammation is caused by an infection. And then oxygen therapy, of course, if you have shortness of breath and parang feeling mo hinihingal ka when you do an activity, so you will have to use oxygen tank with nasal cannula at least to support your breathing. And then pulmonary rehabilitation, so that is a physical activity wherein there would be a breathing techniques na ibibigay sa'yo ng therapies in order for your lungs to function well and para magkaroon ng magandang gas exchange inside your lungs and you will be able to breathe na walang difficulty. And then lung volume reduction surgery. So ang gagawin naman dyan, yung damaged alveoli or the damaged lungs will be removed and then iiwan yung normal lungs or normal alveoli para yung ibang parts ng lungs mo will not be affected and it will still be functioning para at least you will be able also or your lungs will be able to do their function and will be able to exchange gases on your alveoli. And then the last treatment would be lung transplant. So kapag wala nang or yung mga other options are not applicable na, so yung end stage or advanced stage na ng emphysema, then a patient will undergo lung transplant. So what are the preventions? So number one, of course, stop smoking. If you are smoking, you have to stop. And if you don't smoke, do not start. And then limit your exposure to air pollution. So restrict your outdoor activity when there are reports of high smog levels. So kapag medyo mausok, so might as well, kapag meron kang lung diseases or specifically meron kang emphysema, do not go outside na. Instead, you have to stay at home. And then use of respirator mask when exposed to harmful chemicals kasi nga kapag yung harmful chemicals nalanghap natin, it will damage our lungs. And then lastly, the vaccination. So you can ask your doctor if may emphysema ka, you can get a flu or pneumonia vaccine to at least makompensate yung katawan mo and hindi ka maka-acquire ng ibang diseases. Okay, thank you so much for your time, guys, and for your listening. So if you have any questions or clarifications with our topic for today, you can message us through Skype or the APOSI Clinic team. And thank you for your time once again and have a great day. Bye.